Hello to everyone. I am Brenda. I'm Dr. Brenda. I am anesthesiology and I am a pain physician. And today I will present a work that Dr. Guillermo Castorena and I did. It's a review about the theme of regional anesthesia in the prevention of chronic postoperative pain. So for start, we need to know that pain is a universal experience, but this is unique for every individual. Of course, any surgical intervention is a common pain of source, and it depends of, we know that this is a result from a planned incision at a specific point of time. So there's many factors that contribute to the development and persistence of chronic post-surgical pain. It can be related to the surgery, but also we need to know that there's another factors like psychological and social factors. We know that the poor pain management will contribute to a worse experience for the disease of the patient. The things that they studied is that they will have a lower satisfaction, they can have a delayed ambulation, they also increase the incidence of cardiac and pulmonary complications. Of course, this increases the morbidity and the mortality, and they can have a negative impact on the health system because they have a delayed stay in the hospital. We know that the International Association for the Study of Pain, IASP, describes pain as an unpleasant sensory and emotional experience associated with an actual or potential injury, or described in terms of such injury. But we know that acute postoperative pain is a result of nauseous stimulation of the skin or subcutaneous tissues or viscera or neural structures. But the 11th revision of the International Classification of Diseases defines the chronic postoperative pain as pain development or increasing in intensity after a surgical procedure in the area of the surgery, but it is more important the time. They said that more than 3 months of the pain in the surgical area. And also that it cannot be explained by another cause like infection, malignancy, or another pre-existing pain condition. The incidence of chronic post-surgical pain, they can depend about the type of surgery, but the most incidence has been after surgeries like amputation, like 30 to 85%. Also inguinal herniatomy, it being like 5 to 66%, and also thoracotomy. Because of the type of the nerve injury, they can have they can make a central sensitization. So the incidence of chronic postoperative pain, like we said, it depends about the type of surgery. But also we need to take paying attention to other risk factors that can be in the preoperative period, in the intraoperative, or in the postoperative period. In the preoperative period, we need to pay attention about some things about the patients, like anxiety, if the patient have depression, or another life trauma, or another pain states that comorbidities about the patient. In the intraoperative period, it can be related to the type of the surgery, like nerve injury, or the surgical technique, or the anesthetic technique, and pro-inflammatory states. And in the postoperative period, we need to pay attention about the treatment, the pain treatment that we are making to the patients, and also if they are having like chemotherapy or radiation therapy. And what happened to the transition from the acute to postoperative pain? It will be in the intensity of the acute pain is one of the strongest predictors, but it will make that nociceptive information will be transformed in a complex and subjective and unpleasant sensory and emotion experience. But this acute pain will respond to tissue damage or another abnormal function of the muscle or the viscera. We know that the pain is a protective and adaptive and self-limited, but in these cases, the nociception won't be protective, and it will be respond to another modification to avoid another injury. And most of times the postoperative pain will be neuropathic pain. Neuropathic pain is defined by the IASP as pain caused directly by an injury or disease that affects the somatory sensory nervous system. And it will be characterized by spontaneous pain with abnormal sensory symptoms. Why this is related to the surgery? Because persistent pain following the surgery can have neuropathic characteristics. And it has been most in surgeries like thoracotomy, like breast surgery or amputation. And also it will be another components like inflammatory process, central sensitization, and damage of nerves. And this is an examples of the cause of neuropathic pain, and I want you to see that surgery is one of the causes of neuropathic pain, and also phantom limb pain. And phantom limb pain is caused by surgery. And the characteristics of the neuropathic pain can have a negative symptoms and positive symptoms. And negative symptoms can be the hypoesthesia or hypoalgesia. Talking about the surgery, it will be in the site of the surgery. And the positive symptoms can be paresthesias or allodynia or hyperalgesia. So the multimodal analgesia has been another tool for the anesthesiologist, and this is defined as the use of a variety of drugs or combined techniques with different mechanisms of action at the central or peripheral nervous systems level that can make an additive effect or synergies. And the things that we can use are like alpha-2 agonist, dexamethasone, gabapentinoids, or acetaminophen. And this can be anticipated to prevent or modify the nociceptive barrage, and thereby preventing central sensitization. But the multimodal analgesia is have many more advantages, like superior analgesia. We can have multiple agents acting via different pain pathways, and also we can limit parenteral opioid administration and also minimizing the opioid-related side effects. And of course, the addiction that is in many countries to the opioid use. So there are many guidelines for the pain management, the postoperative pain management. We can see the European guidelines or the American guidelines, but all of them have similar objectives, like early mobilization, reduction in hospital stay times, decrease the morbidity and mortality, and also increase the patient satisfaction. But they use the multimodal analgesia, but they have a special use in regional anesthesia. So why is this a recommendation? Because they can have central neuraxial blocks, or in combination with catheter techniques can decrease the inflammation and the stress produced by the surgery. Also, they can improve pulmonary functions and reduce the period of hospitalization with better pain control and also better satisfaction of the patient. What another benefits can have about the regional anesthesia, they can reduce the risk of persistent pain or chronic postoperative pain. And also, if we can read another papers, they said that they can have a beneficial effect in reducing tumor recurrence in cases of cancer surgery. And also, in regional anesthesia, we use local anesthetics, and we know that they have an anti-inflammatory properties, which may also decrease the central sensitization and decrease the chronic postoperative pain. Also, with the regional anesthesia, we have the use of the ultrasound guided, because it provides real-time visualization and targeting of the major nerves and the needle, and it can make the regional anesthesia safer, more efficient, and more accessible to all of the general anesthesiologists. Also, they can increase clinical applications, not just for epidural or paravertebral blocks, but because nowadays we are also managing peripheral nerves and truncal blocks. Also, the use of the ultrasound reduce the complications, make better performance times, and may decrease the local anesthetic requirements. And also, we need to pay attention that the rate of success may increase with the clinical experience. So the conclusions is that the role of regional anesthesia in the perioperative care, it's very important nowadays, because postoperative pain management continues to be a challenge for every health professional. And if we don't treat correctly the postoperative pain, it may become chronic and may cause functional limitation and also psychological distress to patients. We need to identify the risk factors in a patient undergoing to surgery, and we need to try to make the preventive measures. And also, the use of regional anesthesia in the intra or postoperative period can make a difference in the acute postoperative pain and also in the chronic postoperative pain. And also, we can make better satisfaction of the patient, because we can make a multidisciplinary approach. We are continue to studying and to be addressing innovative blocks to prevent treatment, to prevent the postoperative pain, and we should start to try to prevent and to decrease also in the preoperative period, like planning and since the preoperative, and to extend to the recovery period, so to prevent the postoperative pain. Also, the adoption of ultrasound guidance is, we can make that, this is a gold standard to make the regional anesthesia to the paravertebral blocks or the epidural blocks or truncal blocks, to adopt the ultrasound guidance. Also, we need to improve the efficacy and the safety of regional anesthesia, because nowadays we are studying more about postoperative pain and also regional anesthesia and a lot of type of blocks. So this is the paper that Dr. Guillermo Castorena and I wrote, a review about the regional anesthesia and the prevention of chronic postoperative pain. You can find it in Intake Open, and this is my mail if you have any questions.